Hey everyone, welcome back. This is Dr. Bhavesh Patel, and I'm here with doing another webinar. It's another webinar on testosterone therapy. Today we're talking about specifically the testosterone therapy itself. I'm excited to go through it with you. I wanted to remind everyone that I've been doing this type of medicine for 11 years. Hormone replacement therapy is something that I think is very important, and everyone should consider in terms of improving their overall health and longevity. Uh, we found that there's decreased mortality, lower risk of cancer, lower risk of diabetes and metabolic syndrome. Uh, that's just from the medical standpoint, but from the short term, how you feel perspective, your physique is better. There's less body fat, more muscle, better results from exercise, better recovery from exercise. There's better ambition and mental focus. Mood is better. That always leads to generally better relationships because you're feeling better and you treat people better around you. So it's one of the really fun things that I love about doing this kind of medicine is to see those kinds of changes in people's lives. And so, while the other ones we considered before, the other webinars we considered uh, the basics of hormones and the understanding about how their body makes them. On this one, we're going to think about ways to improve the hormone production. Now, we described earlier that hormones do tend to go down over the course of time for men. Testosterone levels start to decline starting around the age of 30, maybe even a bit earlier, about 1 to 3% per year. And as they decline, uh, you start having some of the symptoms that I described earlier. There are lifestyle factors at play, so it makes sense that natural treatments would include your lifestyle factors. When it comes to exercise, lifting weights helps improve testosterone levels. High intensity interval training helps improve testosterone levels. Uh, Playing cardio will also have a bit of an impact on helping with improving testosterone levels. Diet, making sure you're getting a good balanced diet with lots of nutrients. That's all of your macronutrients, carbohydrates, proteins, and fats. Obviously, we talked about in other videos the proportion of those uh, in terms of, you don't want to have so many carbohydrates that you're overpowering the hormonal system with too much insulin because carbohydrates do tell the body to make insulin. You don't want too much of that in your body. But again, a good healthy balance is without carbohydrates. I mean, that's one of the essential macronutrients. So you still need that to build muscle. We talked about stress. Stress is going to decrease your hormone production. Bad sleep is going to decrease your hormone production. Lifestyle factors such as being overweight or smoking or alcohol, all of those reduce testosterone production. So, these are areas where you could kind of look this stuff up too on Google, um, as far as some of the treatments you can do that are natural. There are some vitamins that help too. Uh, specifically, there's vitamin D3 helps a lot. There's a number of reasons to take vitamin D3, so that's good. Zinc helps. Ashwagandha, which is an adaptogenic herb, is great for reducing testosterone. I mean, sorry, increasing testosterone production. And that's great for sleep. It probably has an impact on better sleep, lowering cholesterol levels, and therefore improving testosterone. Those are some of them. There's a number of other ones. But like I said in a previous video, despite all the testosterone boosters that are out there and the supplements and medication and lifestyle things you can do, your body is getting older. There's also the endocrine disrupting factors, the phthalates and plastics that affect the endocrine systems, birth control pills, flush down the toilet, whatever it is. Those endocrine factors that we can't control are still affecting our systems. I have found in my practice, we do have some patients who want to start with nutrient supplementation, exercise, and lifestyle. We might get a mild improvement in hormone levels, but generally it requires replacement therapy. And that's what this webinar is going to cover the different ways to do that. Let me just start with the production pathways of how the body makes hormones as a reminder. Um, so, again, we start with luteinizing hormone, as the hormone that comes from the brain, and that's a signal to make testosterone. Okay. So that signal to make testosterone starts at the brain. If you're low on testosterone, the signal goes up. If you have enough testosterone, that signal goes down. The body is going to make from that, you're going to have a production of DHEA, which can turn into testosterone. It can also turn into estrogen, and it can also turn into DHT. Now, we talked a little bit in the previous video about the different labs to check. Today, I just want to think about where can we intervene from a production standpoint to improve the levels of testosterone. Well, one is we can increase the drive, right? We can increase the signal of testosterone. So there's an opportunity there. There might be an opportunity here with a supplementation of DHEA because we know some of that turns into testosterone. And then we can do testosterone itself. So those are the three components of what we can do to improve testosterone levels. Well, this one is a supplement, okay? And this is generally taken orally, meaning you swallow it by mouth. And it's usually daily or a few times a week. For most people, I'm thinking I usually start 10 to 20 milligrams per day, or I might do 25 milligrams every other day. But I've seen doses as high as 100, 200. Each person is individual in terms of how much they need. This is again where if you're taking a supplement, uh, this is one that you would do the test. You'd see after you take the DHEA where your lab values went to. So you test the DHEA levels. I found for some people, very little has a huge impact, and other people, you need just so much DHA to get an impact on the DHA level. Now, that doesn't always translate to more testosterone. It can sometimes translate to more estrogen. So, again, we just kind of follow that by labs and see how you're doing. All right. Now, so that's that one. Let's take the case of increasing the luteinizing hormone or the signal that's going this way. So, the ways to do that are going to be two. Historically, we've always done something called human chorionic gonadotropin, HCG. Okay, so human chorionic gonadotropin is structurally similar to luteinizing hormone. So what that means is because it looks like LH, let's erase that here. Because they look similar, they can both sit on the same receptor um, on the body. So whether LH gets in there or the HCG gets in there, we still get the same stimulation, and then that tells the body to make more testosterone. So that's how that one works. This is great for people who still want to maintain fertility uh, and the body's natural production of testosterone. As a reminder, when your body has enough testosterone, if you have good levels here, there's a signal to decrease the production here. It's going to decrease the LH. So if you want to just make sure your body's producing testosterone, you want your testes functioning, this is the way that you do it. Now, the problem, and why I said historically, is HCG used to be fairly easy to get and fairly inexpensive, a bit more expensive than testosterone. But in the last couple of years, it's been harder to manufacture it. Manufacture compounding pharmacies aren't making it anymore. There's some new rules and regulations around it. You can still get it from pharmaceutical companies. The price has gone up at the pharmacy for it, and it's often back ordered. So I don't find it to be a reliable source anymore. So we're moving over to clomiphene. This has been used for a long time as well for improving testosterone levels. Clomiphene is a fertility drug. And the way it works is in the brain, it blocks the estrogen receptor. There's a little estrogen receptor here. And clomiphene essentially blocks this receptor. Okay. So once that receptor is blocked, the body feels there's not enough estrogen. So it actually increases the production of LH. It also increases the production of FSH, which is a follicle stimulating hormone. Now, this one goes off to make sperm at the end of the whole thing, and that's why it's a fertility drug. The LH is what goes on to make the increased testosterone. Okay. So, again, this is another nice natural way of getting the testosterone levels boosted. There's different dosing regimens around it. I usually stay pretty conservative, usually at every other day or every third day dose. Uh, there have been historical doses where it's even like twice a day of the clomiphene. It does have some side effects. Sometimes I've seen it affects people's libido negatively, even though the testosterone is going up. It has something to do with the estrogen receptor. There's a couple other serious complications. I've never seen it, but again, that's one of the reasons I'm a little bit more careful and conservative with clomiphene dosing. So the next step is, what if we just increase the testosterone levels themselves, right? So this is our third way of doing it. So we have a prohormone. We have a hormone that is going to stimulate the production of the whole chain. We have a medication that blocks the receptor, increasing the LH and the FSH, or the mimicker, the HCG, right? So those are the ways. The last way is just to put you on testosterone. And if you go on testosterone, to me, for men, there's pretty much two considerations. It's either going to be injectable or pellets. Okay. So let's talk about the benefits of each of those and the differences and why I like what I like on these. So, injectable testosterone is injected generally on a once a week basis. In our practice, we teach people how to inject their own testosterone. So, once we come up with the right dose, I teach my patients how to measure it, how to self inject the testosterone. I have them do it in their thigh. Some people have testosterone injected into the buttocks. The half life of testosterone is about 8 to 10 days. So usually once weekly dosing works pretty well. Having said that, everyone's different in terms of how they metabolize testosterone, how much they need, and what level is right for them. As we discussed in a previous video, there's many points of variability for testosterone to work, and I'll explain what that means in this regard. When you inject testosterone, it's connected to a molecule called cypionate. It can be something else like ananthanate or propionate, but the testosterone is connected to cypionate, the one that I use. And that's so that the testosterone doesn't shoot up in your bloodstream all at once. Okay. So if you had taken testosterone with not bound to anything, it would just shoot up really high and then come back down again. Right. So that's not what we want. If this is day one and this is day 7, you don't want all your testosterone showing up on day one. So the cypionate is supposed to help smooth that out over the course of the week. So your body has to break this testosterone off to make it free testosterone, and that ends up being a point of variability. So how fast your body breaks that testosterone off and makes it available to the tissue is variable from person to person. So we found that that means while some people might have a testosterone curve where it spikes up pretty quick and goes down, for other people the testosterone might last a little longer because they don't break it down as quickly. So that's kind of how I sort of determine the dosing. So sometimes it's twice a week. For me, sometimes it's just every 5 days. And the way I figure that out is based on your symptoms. It's, how good do you feel and how long do you feel well? Do you feel like you need that shot on the last day? Or is it a couple of days where you're feeling run down and you need the testosterone? Um, why not just do it twice a week? Um, well, sometimes that's just too much testosterone all the time. If you recall, the hormones are released in a pulsatile fashion, and I feel like having the testosterone levels go up and down in the body allows for it to be more how the body's expecting it. There's another concept that's called testosterone receptor downregulation, meaning if there's enough testosterone in the bloodstream, so let's say these are receptors on a cell, if there's enough testosterone out floating around, the body's not really hungry for testosterone. It knows it's there. I think about it this way: if your spouse is always nagging at you, after a while you just stop hearing the spouse, right? Because it's not unnormal for the nagging to happen. Same thing with the testosterone. What's going to happen is you're going to start seeing some testosterone receptor downregulation, meaning maybe whereas there's 4 or 5 receptors, now there's just two because we don't really need the testosterone. We've had plenty of it. On the other hand, if there's only a couple of molecules of testosterone around, the body starts to upregulate the receptors. And so now it went from like maybe 2 or 4 to 5 or 6 receptors. You just get more receptors because it's so much more scarce. There's more hunger for it. Again, this is all back to the body's mechanisms of homeostasis and using what it needs. These are just biological processes. So that's why this pulsatile fashion, I think, mimics the body a little bit better. Uh, and that's why the dosing can vary, whether it's once a week, that's where most people are going to be. I like every 5 days. Some people do best at twice a week. But that's kind of how the testosterone's given. It's a self-injectable uh, with a variable dosing schedule. We sort of figure out how much the right amount of testosterone is and how often to give it based on your clinical symptoms. We check labs in 2 months and then every 3 months after that to make sure that the levels are where they're going to be. Now, what's the downside of it? Well, you have to give yourself an injection. It's a procedure. Sometimes it's kind of a pain in the butt. I mean, no pun intended. It's kind of, pain in the leg, whatever. But, it can be a little inconvenient from that perspective. To me, the benefits outweigh the negatives because I can modify the dose and get very specific with what's right for the patient. Uh, but there's pellets, insertable pellets, which you may have heard of. This is where you have pellets that are inserted into the skin, underneath the skin, and they stay there for about 3 or 4 months or so. The advantage is it's a one-time procedure. Well, one-time procedure for 3 or 4 months. You've got to go back in and get the pellets put back in again. But you put the procedures installing usually for men somewhere between 8 and 12 of these little rods. They're about an inch long and maybe about a millimeter or two thick. And you sort of insert them, just side by side underneath the skin. Uh, and they stay there and they slowly bring the testosterone out over time. And then it starts to wear down. Now, in my opinion, and this is mine, I'm sure there are plenty of patients who are very happy and successful with pellet therapy, and I know there's a lot of doctors doing hormone replacement with pellets, and they're very successful. I'm probably just seeing the ones that don't do well on pellets. What I found is generally they feel great for about 2 or 3 months. The patients feel great, and then months 3 and 4, They don't feel as good as they did, but the levels of T levels are still high, but the symptoms are low. Like you're not feeling so good, but the levels are still pretty good. And you're kind of waiting for the levels to come down. I think it has to do with this down regulation concept I was talking about before. So from an efficacy standpoint, that's just what I've experienced. Um, the other just downsides of the procedure is that it can be a little bit painful to do the procedure. Um, Sometimes they can get infected. Sometimes they can extrude, meaning they come out of the skin. I've heard essentially that takes about the pain lasts about a week. If they get infected, that could be a problem. If some of the pellets come out, that could be a problem. That probably doesn't happen to most people, but it's a consideration for people to think about. Uh, the convenience of it is you're not taking a shot once a week. You just kind of like set it and forget it almost until it's time to get your next set of pellets. There, you're going into the doctor's office for a procedure with the testosterone. You're doing it yourself, and so there's not really anything follow up required for therapy except for the routine follow up regarding your labs and doctor visits. Um, Last piece is what you're going to monitor on therapy. You want to monitor your testosterone levels. Okay. Testosterone converts into estrogen, so you're monitoring the estrogen. You're monitoring your PSA levels. That's prostate specific antigen. We're here. What we're trying to do is watch out for signs of possible cancer. Uh, the prostate specific antigen is prostate specific, not cancer specific. So inflammation or enlargement of the prostate can just cause it to go up as well. We're checking dihydrotestosterone levels. This is the one that can cause some hair loss. And you're checking your CBC. We're checking what's called a hemoglobin and hematocrit. That's a number that's part of the complete blood count. That's what CBC stands for. It stands for complete blood count. Testosterone does tell the body to make more red blood cells. Those red cells make the blood thicker. If it gets too thick, your heart has to work a little harder to push that blood around the body. So that's why you want to just make sure the blood's not getting too thick. The treatment for that would be donating blood. Um, then, of course, the symptoms you're going to monitor are, nipple tenderness. That's going to be from testosterone converting into estrogen and causing some breast tissue enlargement. So you're going to watch for that. You might watch for some acne. You're going to watch for mood changes. You might watch for testicle size. If the testicles get small, we can stimulate the production of testosterone. I'm sorry, the testicles to get larger. Uh, so you watch out for that. Sometimes people want that. So I've seen that happen before. Um, Watching for hair loss or hair thinning. You might get a little acne. Maybe short term, there might be a little bloating. That's not too often. But those are the main ones. There's a few others probably, but generally those are the things you're looking for on an ongoing basis. Follow up labs, symptoms that you want to watch out for. So let's see. In summary, the treatment options for testosterone get down to: are we treating it just with a pro hormone like DHEA? Are we mimicking luteinizing hormone and making your body produce more of its own? Or are we just going to give testosterone? And with the testosterone, we know we're going to get the levels to where they need to be. Then you're watching for the side effects of testosterone, of having too much, the estrogen levels, et cetera. Hopefully, this has been informative. You understand a bit more about what your options are for treating testosterone and having a replacement therapy that's going to be effective in helping you have an optimized, healthy lifestyle, a better life, longer life. And getting the body that you want. Angela, I think that's it for my presentation today. Hopefully, if anybody has any questions, please drop them in the chat, and I'd be happy to answer them.
Dr. Patel, we actually have a lot of questions for this one. One of them is somebody said that their doctor had recommended a cream for testosterone. Is
Yeah.
there a cream that can be used to increase it?
Yeah, there's creams and patches that will increase testosterone. What I have found is this is like you get the testosterone levels up, but I've never had a patient that actually felt better by doing the cream. Um, so this is sort of like revving an engine that's not connected to the motor, or it's not connected to the wheels. The motor's running faster, but the wheels aren't spinning. That's just my experience. I'm sure there's some mild effect, but I've certainly when I started the practice, I did some more creams. It's a lot of cream you have to put on. You have to put it on every day, and the results just weren't the same. When it goes through the skin, a lot of it enters what's called the lymphatic system, which is part of your immune system, and then it converts into dihydrotestosterone, which is the issue that causes some hair loss and prostate enlargement. So there's creams and patches, but for me, the injectable works the best.
Dr. Patel, you mentioned some of the side effects. Someone had a question about a side effect like acne. Is there something that you can take to combat side effects like that?
Yeah, so I guess it depends on how bad the acne is. So the first thing I like to try to do is see if we can modify the dosing. If the acne is significant, where the testosterone is causing it, we're going to reduce the dose of testosterone and see if that's the primary driver of that acne. Um, but sometimes there's an underlying cause. Maybe there's already like a pre-existing sebaceous gland or a pre-existing possibility of getting acne. There might be some bacteria there, especially the kind of acne that people get on their back. So sometimes a course of antibiotics is required for that. Um, there is a medication called spironolactone. Sometimes that helps prevent the acne production. Um, but I'll generally address the testosterone first. If that's not really the cause, or if lowering the dose really didn't change it, and there's some underlying issue, we'll address the underlying issue. Um, Obviously, taking the testosterone away completely might get rid of the acne, uh, but then we're losing all the benefits of taking testosterone therapy, and there's probably just an underlying reason why the testosterone is causing so much acne.
Dr. Patel, we have another question regarding fertility drugs. Does using the injectable testosterone cause fertility issues?
That's a really good question. That's a great question because the testosterone, if you're using testosterone, it does lower the body's production of luteinizing hormone and follicle stimulating hormone, that FSH, which is the hormone that's going to stimulate the cells called Sertoli cells to produce sperm. So sperm count will go down. Now, I can say that in my practice, I've had people who wanted to have children, and we've treated them with testosterone. Uh, I'd never use doses that are so high that they completely suppress the body's production of testosterone uh, or sperm. But if somebody's looking to have children, 3 or 4 months before they're trying, because that's about how long it takes for sperm to mature, we might decrease the testosterone and add a fertility drug, or get off of the testosterone and just do the fertility drug. But certainly, I've had several patients who have beautiful children even after being on testosterone therapy.
We have one last question. Can things like the injectable testosterone and the DHEA or clomiphene, can those be taken together, or is it just one or the other?
Yeah, that's a good question. So routinely, I'll treat both with DHEA and testosterone. That's pretty typical. For most men who are past the age of of wanting to have kids, it'll generally be testosterone only, unless the testosterone is causing the testicles to shrink enough that they don't like it. And then you'll add in some clomiphene, which will stimulate the body to make more of its own testosterone sperm. Testicles get a little bit larger. Um, so if somebody's still looking to have children, but they don't know when, we might do a combination of testosterone and clomiphene. So that's an option. The last piece is you might do testosterone by itself for 5 or 6 months, and then maybe every year or a couple times a year, do a month or two of Clomid just to keep your body still producing its own in case you're concerned. In my practice, though, generally, even if I've had people only on testosterone and they get off of it completely within about 4 or 5 weeks, most their levels start to come back to where their body was naturally producing. And if I check their labs again, they're going to be about where they came in with before we ever started therapy. So, hey guys, that was what we have time for today. Hopefully, this answered a lot of questions and you have an insight into testosterone therapy and just the various considerations. There are a lot of low T clinics out there. I don't know if all of them are thinking about all the different variations and symptoms and thoughts around the dosing and what other options there are and how to think about it. Again, the numbers are really important to help make sure you're not way outside the rails. But at the end of the day, you're treating a patient, you're treating an individual who's going to react to the amount of testosterone differently. Again, just the one I shared with you today was just how the testosterone is broken down, but there's ways that it attaches to the receptor and has different impacts on different people. So, um, but this was a this hopefully will just at least get you there where you know the different things that I think about when I do testosterone replacement therapy. If you have questions and want to follow up, feel free to go to the website, BhaveshMD.com. I'll have this webinar posted. We'll have a way for you to either make an appointment with me for a phone call. I'd be happy to chat with you. Or if you want to ask some questions in the comments, we'll answer those. And hopefully everyone gets some value out of that as well. Let's see. Have a great day, everyone, and thank you very much. Take care. All right. Stop recording.